My name is Dr. Stefan Bajon. I work here in San Diego at the Clifford Center for Structural Balance, and I am a nutritionist, a pharmacist, a nutritionist, and also a traditional naturopath. And I got interested in nutrition during the 80s when I got sick myself and was very overweight, was eating foods I grew up with in New Orleans, mainly sugar, starches, and lots of fruits, grains, cereals made out of high fructose corn syrup, drinking a lot of dairy, and blew up pretty much and got diabetes myself, actually, and had to cure myself of that by finding out what was really causing it. It was caused by my overweight condition, eating too much sugar and starch and wine. So I cut all those things out and cured my diabetes and arthritis, and then went back to school in the 90s thinking I could study and get out of the pharmacy profession. I used to fill 2 prescriptions during the 60s. It went to 3 to 4 in the 70s, 5 to 6 in the 80s. By the time the 80s were ending, I was getting 5, 6, 7, 8 prescriptions at a time to fill. Doctors were writing prescriptions by the millions and billions, and that's when they started to do the advertising on television for drugs. And once that came in, I knew, boy, it was going to be really big. Well, Big Pharma and our government has been in bed with each other for a long time. And one of the problems is that we don't really have anybody representing us about nutrition. Thousands of studies have been done on nutritional supplements and the deficiencies in the American people. Almost everybody has deficiencies. Even people will say, well, I eat organic food. Yeah, but the organic food just means that the crops are processed a certain way. If the soil is depleted with things and it doesn't have any genetically modified organisms in it, but it still doesn't mean that they have all the iron. We used to have about 60 milligrams of iron in a certain portion of the soil back in the 60s. Now I think you got 4 milligrams. So that's a major amount of mineral that has been depleted from our soils. So I was looking around for ways in which how can we motivate people to learn about nutrition and realize that that the government, which is supposed to be protecting us, gave us a food pyramid to eat, which during the 70s we had maybe 10-15% people obesity. In the last 60 years on that experiment, it's now going up to 60-70% obesity. They're actually using words like globesity and diabesity, diabetic epidemics in the culture. So one of the things that has always been kind of a tough thing to realize is that we have a serious problem with eating sugar. In fact, the average person in the United States is now eating 200 pounds of sugar per person per year. Back 100 years ago, they ate about 20. Person eats more sugar by the time they're 8 years old in this country than they ate when they were 100 years old 100 years ago. So not only that, sugar has been loaded with these high fructose corn syrup, these artificial sweeteners like aspartame, which turns to formaldehyde in your body, and the new chlorinated alcohols called Splenda, saccharin. The best one we try to recommend with people is stevia, and I'll talk a little bit about that maybe in another interview. But one of the things that I wanted to just quote from a new study that just came out called Death by Medicine. In the first paragraph, it was done by 3 PhDs, 2 MDs, and 1 naturopath. And it's very interesting. It says, something is wrong when regulatory agencies pretend that vitamins and supplements are dangerous, yet ignore public statistics showing that our government-sanctioned medicine is the real hazard. Our government-sanctioned medicine is the real hazard. So the SAD diet, the Standard American Diet, which is a diet that was promulgated by the American Dietetic Association, American Heart Association, to tell people to eat more grains, eat more fruits, eat less saturated fats. They demonize coconut oil and palm oil, which are 2 oils along with butter and ghee and good avocado oils, things like that. good flax oils. These are the saturated fats that actually protect our body. It's the polyunsaturated fats that are causing all the problem. There's a recent study on a picture of Time magazine showing butter is now good for you after all of that controversy. Well, what's going on is that people are so confused. They just don't know what to eat these days. And everybody is motivated by different things. Trying to change somebody's diet is trying to change their religion. So I try to just tell people, look, we're going to do a live blood analysis. Live blood analysis has been demonized in our culture. If you go to Wikipedia, they say it's quackery because it actually shows what is going on within a person's bloodstream in their red blood cells, their white blood cells, their platelets, their plasma. And this is an analysis. It's almost like a DNA analysis, an energetic fingerprint of what's going on in your whole body. It's a hologram. And one of the ideas is that to find out where the deficiencies and find out where the stresses are in the body, or if there are any parasites or fungus or molds or yeast or bacteria. And doctors all over the world are using the live blood analysis. They use it all over Korea, they use it in Germany, they use it in Italy. But it's been demonized here because of one fact. Because when it started, people were using it to sell supplements. Well, I don't sell supplements. You could go online now, and any supplement a doctor sells you in his office, you could buy for 50% off at Vital Cost or iHerb or even Amazon has discounted prices. So it's ridiculous to say, oh, all doctors just want to do is sell you supplements. I don't sell supplements. I know a lot of nutritional microscopists that don't sell the supplements. What we're dedicated to do is to get people back on foods that are high in good vegetables. I don't even like to use the word carbohydrate because it doesn't mean anything. A bowl of sugar, a bowl of broccoli, and a bowl of oatmeal. They're all carbohydrates. They don't mean anything. Bowl of fruit, they're all carbohydrates. But what does mean something is to eat organic foods. Organic foods make sure that you don't have genetically modified bacteria and you're eating viruses that have been genetically modified. Seeds that Monsanto will try to push down the American public's throat. It's making people sicker and sicker and sicker. By the way, if you haven't seen the movie Sicko, where our government was lying to us about how bad it is in Canada and England, where people were getting bad medical treatment, and Michael Moore showed it wasn't there that we're getting bad medical treatment. It's over here we're getting bad medical treatment. The medical treatment in the United States is so bad we're like at number 79. And one of the things that it has now moved into, that death by medicine is now the #1 killer in the United States. #1 killer, above cancer and above medicine. Adverse drug reactions, 420,000. Bed sores, 115,000. Infections, 88,000. Surgery deaths, 32,000. Just on and on and on and on and on. So what I think it's gonna take is for people to wake up, realize that you got to take your responsibility for your own health. This is really important, Nobody's going to do it for you. I tell my clients, if you're not willing to take the supplements, because you can't get it, even if you eat good foods, you got to take some supplements. Every study known to mankind, have done hundreds of thousands, show that people have massive deficiencies. Many women, 90% of women are deficient in iron, 90% of people are deficient in magnesium, deficiencies of all kinds of different B-complex vitamins. So to say that we can get our vitamins by eating the sad standard American diet is just plain deceitful, and it's a lie. It should be a crime to say these kinds of things. So the live blood analysis is a way to help people to find out what is really going on. I made a little brochure called What is Really Affecting Your Health? Live Blood Solution has the answers. And in it, I go over a quote I like. It says, "The day has come when one can ascertain the imbalances of the physical body as holographs made from inside one drop of blood from your finger, from one fingerprint." Dark field blood analysis uses a high-definition microscope to analyze your blood. It's a very useful for the early detections of various diseases. A lot of times when you go get to the regular blood tests, then they're good, they're not all, they help you, but they show the fruit after it's already turned rotten. Diseases don't all of a sudden come on one day. They take diabetes takes a long time. Cancer takes a long time. But the test won't show up in the regular blood test until one day you got diabetes. It actually happened to me back when I got sick, when I was overweight. Blood sugar went up to 800. You know, it was like all of a sudden it was 100, and then one day it was 800. What happened? Oh, now I got diabetes. Now I have to shoot insulin, and I cured myself of that by beginning on nutrition and the proper supplements along with exercise. So movement is very important in this whole program. But the king of health is nutrition. We call it the king is nutrition, the queen is exercise and movement. But by taking one little drop of blood from your finger, and there's a video I have on YouTube called Death by Sugar, which shows this whole process of what happens when you eat bad foods, what it does to your blood. It's very interesting. It was made about 5 years ago by Jorge Cruz. So what I like to do is take the drop of blood, put it on a slide, and then I focus the microscope and tune in to look at the plasma, the white blood cells, the red blood cells, see if the membranes are intact, see if they all have the right physiological form. You can tell a lot by deficiencies of B12, folic acid, iron and stuff. If the cells are misformed and misshapen, you can tell a lot about hormonal imbalances by looking at ovulocytes. That's the term we use for red blood cells that become oval. And crystals in the blood. I'm a big believer in using the good oils. The good oils are the coconut oils, palm oils, butter, ghee, even lard. Even lard is good to fry in. But the polyunsaturated corn oil and this canola oil, these are all filled with trans fats and are highly dangerous for people to be consuming. And people are consuming way too much of this, eating way too much fruit. Many people don't realize Dr. Lustig at the University of San Francisco has found out that fruit sugar is what's causing insulin resistance. This is the big culprit in causing diabetes. And in fact, it's amazing how much it's causing cancer. They find out how many tumors a person has in their body by giving them injections of sugar and lighting up the PET scans, because that's what cancer feeds on, is sugar. That's what that is the number one health priority. We got to cut down on high fructose corn syrup and high sugars in the body. Again, try to look at that Death by Sugar video. It's only 2 or 3 minutes long. But when you look at the blood by just taking the time, it doesn't even hurt. It just takes a simple, like little pinprint. The person does it themselves. Bam! I get the drop of blood on the slide, and I have a $20,000 dark field microscope where you can put it on a computer screen, and your living blood shows up on a monitor before your very eyes. And when you see that happening, and when you see a parasite crawling across the screen, or you see a candida fungus in the blood from people who have had so many antibiotics, or swimming in chlorinated pools, or have just been, their immune system has been compromised by so much irradiation, this is very exciting for them because it motivates them to then change their diet. So that is a very, very, very good tool, as long as you don't get involved with the conflict of trying to sell these things to people, because I don't get any kickbacks from any companies by selling it. So if you suffer from diabetes or blood pressure or gastrointestinal problems or various thyroid, hypoglycemia, adrenal problems, chronic fatigue syndrome, anxiety, pain, depression, all of these things are being caused by an imbalance in the body. I'm not saying everything, because the trauma, along with toxicity, is what causes most disease in the body. Body becomes toxic, it doesn't get the things it needs, and then boom, the next thing you know, your body cannot assimilate the foods and the vitamins and minerals that it needs. So when I saw Maya Angelou talking to Dave Chappelle a couple of weeks ago on her television, she says, it's okay to be angry, David, but you never want to be bitter from your traumas in your life. So we know that resentments can make a person ill. So I don't really focus on so much on the psychology part of it. I try to work with people by restructuring their diet. It takes me 2 to 2.5 hours to go over the whole program, set them up on the right foods that are individualized for them. And I do this individualized process by doing muscle testing. It's called applied kinesiology. You can find out exactly the right dosage for the person and exactly the right amount, and then testing the muscle test to see if that particular product is compatible with their physiology. Sometimes there's binders in it that the person may be sensitive to that they don't like. I made some pictures of different conditions going on. Here's some pictures, by the way, of healthy red blood cells. You can see they're all nice and uniform here, and you see the nice G in the middle. And then there's different kinds of things, like here's mycoplasmas that show up in the blood. Rouleau is a stress-related situation when the blood cells lose their charge, and if the blood cells lose their charge, the body becomes acidic. And one of the things we try to aim for by making people eat saturated, very good saturated oils like omega coconut oil or Bariani olive oil or the Carlson's cod liver oil, very, very good non-rancid oils. That all helps a person enormously to break up the acidity in the body, and to, if you can't afford the grass-fed beef, eat the wild-caught fish. Try to get people to eat barley, and gluten has become a big problem these days. So we try to get people into substituting other foods for gluten. And I put a whole program together of good foods that people can eat that taste good. Nobody's going to eat food that doesn't taste good. So they come in, you get a whole report. I take pictures, send them to you, and give you a complete report of what's going on by showing you the pictures on the computer screen, and then helping you to realize what it is that's best for you on an individual basis. So Roger Williams had the right idea a long time ago: biochemical individuality. One man's meat's another man's poison. Find out what the right foods for you to eat. Find out what the right vitamins and minerals and trace elements and enzymes and amino acids are the right things for you. And if we need to do a detoxification, I'm a specialist in detoxification, so this is very, very important to help the liver. A lot of people are suffering from liver and kidney detoxification. You have to get the liver cleansed out and the kidneys cleaned out before they'll be able to assimilate. It's not what you eat, it's what you can assimilate of what you eat that's important. That's the ticket there. So by doing that, and then by going over all of the tests and showing you all the pictures, as I say, if you're willing to invest 2.5 hours of your time, 2 to 2.5 hours of your time, this would be worth your while in gold. In ancient times, the alchemists used to try to turn lead into gold, but it was just a metaphor. The gold, G-O-L-D, the true gold, was your health. And the lead was all of the lead that people have trying to carry around with them because they're so tired. They're suffering from pain and depression and anxiety, and it's just getting epidemic. So that's my passion in life. That's my goal. You could call me at 858-336-7869. Dr. Stefan Bajon. LiveBloodSolutions.com is the website. And I'm right here on from Moraga Avenue in the De Anza View Medical Building in San Diego.